Hi all, welcome to Physio Exam Buddy. This video is on the transport of oxygen in different parts of our body. Oxygen delivery to a particular tissue, it depends upon the amount of oxygen entering the lungs and the adequacy of the pulmonary gas exchange, that is gas exchange between the alveoli as well as the capillaries, and the blood flow to the tissue, that is oxygen delivery to the tissue. It also depends upon how much blood flow is going on to the tissue and also on the capacity of the blood to carry oxygen. So these are the factors on which the oxygen delivery to the tissue is dependent. You all know that oxygen, it have to be transported from the atmosphere first into the lungs, and from the lungs it is carried by the arteries into almost all tissues of the body. So how the uptake of oxygen occurs in the pulmonary blood? The partial pressure of oxygen at the alveolus, it averages around 100 millimeters of mercury, whereas the blood, that is the venous blood entering the pulmonary capillaries, they have a partial pressure of oxygen of only up to 40 millimeters of mercury. So the pressure difference between the alveolus as well as the pulmonary capillaries, now it is around 60 millimeters of mercury, and because of this pressure difference of 60 millimeters of mercury, it causes the oxygen to diffuse into the pulmonary capillary from the alveolus through our respiratory membrane, and the blood partial pressure of oxygen rises almost to that of the alveolar air by the time the blood has moved a third of the distance through the capillaries. But after some time, when it reaches the level of the aorta, the partial pressure falls to about 95 millimeters of mercury, and this is because of the presence of the physiological shunt or the venous admixture. Now the oxygen from the alveolus have entered into the blood, and in the blood oxygen is transported in two forms. The first one is the dissolved form. Through this form, only 1% of the oxygen is transported by the dissolved form, whereas the rest 99% of the oxygen in our body, it is transported in combination with the hemoglobin. So these are the two forms by which the oxygen is transported in the body. The amount of oxygen in the blood, it is determined by these three factors, that is amount of how much is the amount of the dissolved oxygen and how much is the amount of the hemoglobin in the blood, and also on the affinity of the hemoglobin for oxygen. Now in detail we will see the first form, that is the dissolved form. As already told, only 1% of the oxygen is transported in the dissolved form. The amount of dissolved oxygen, it is 0.003 ml per deciliter of the blood per millimeters of mercury partial pressure of oxygen. Therefore, at a partial pressure of oxygen of 100 millimeters of mercury, only about 0.3 ml of oxygen will be dissolved in 100 ml, that is per deciliter of the arterial blood. And you all know that in the venous blood, the partial pressure of oxygen is 40 millimeters of mercury. So the dissolved amount will be only 40 millimeters. So in 100 millimeters, it is 0.3. So in 40 millimeters, it will be only 0.12 ml per deciliter of the blood. And according to Henry's law, it states that the amount of dissolved oxygen at a given temperature, it will be proportional to the partial pressure of the oxygen. So, thus, there is no limit for the amount of oxygen to be carried in the dissolved form, provided the partial pressure of oxygen is very high. So, this is actually a distinct advantage over the oxygen transport as oxyhemoglobin, which cannot exceed a certain limit. So that is the advantage of the transport of oxygen in the dissolved form. Therefore, this dissolved oxygen at high PO2, that is at high PO2 means hyperbaric oxygen therapy, that is dissolved oxygen at the high partial pressure of oxygen. It is mainly used in the clinical practice for the oxygenation of the tissues when the hemoglobin get denatured in the carbon monoxide poisoning. And this can be asked as a physiological basis question, and it is mainly based on the Henry's law, which states that the amount of dissolved oxygen at a given temperature is proportional to the partial pressure of oxygen. So if you are giving hyperbaric oxygen therapy, you will be giving dissolved oxygen at the high partial pressure. So there is no limit for the amount of oxygen that can be carried in the dissolved form, provided the partial pressure of oxygen is sufficiently high. So this practice is mainly used for the oxygenation of the tissues when the hemoglobin get denatured by the carbon monoxide poisoning. The rest 99% of the oxygen, it is transported in combination with the hemoglobin, and the presence of hemoglobin increases the oxygen carrying capacity of the blood to around 70-fold. Reactions of the hemoglobin with oxygen. Hemoglobin is a protein which is made up of 4 subunits, and each of which contains a heme moiety attached to a polypeptide chain. And this heme, it is a porphyrin ring complex that includes one atom of the ferrous ion. And each of the 4 iron atoms in the hemoglobin can loosely as well as reversibly bind with one oxygen molecule. And the iron, it will stays in the ferrous state but not in the ferric state. The iron will stays in the ferrous state, so that here the reaction is oxygenation and not oxidation. Because it contains 4-deoxyhemoglobin in each Hb unit, the hemoglobin molecule can also be represented as Hb4, and it will actually react with the 4 molecules of oxygen to form Hb4O8. So this reaction, it is known as the heme-heme interaction. That is, first of all, the 4-deoxyhemoglobin Hb4, it will first combine with an oxygen molecule to form Hb4O2. Again, it will increases the oxygen carrying capacity of the hemoglobin. So it will again combine with the oxygen to form Hb4O4. Then again another oxygen molecule will come and bind with the third site of the hemoglobin, forming Hb4O6, and finally it will react with the 4 oxygen molecules to form the Hb4O8, and this reaction, it is known as the heme-heme interaction. And this reaction, it is very rapid, requiring only less than 0.01 second. And the deoxygenation here, that is the reduction of Hb4O8, is also very rapid. The quaternary structure of the hemoglobin, it determines its affinity for oxygen. In deoxyhemoglobin, you can see here that the globin units, it is tightly bound. They are found, the globin units are basically found in a tightly bound state, that is in the tense configuration or T configuration. This will reduce the affinity of the molecule for oxygen. But when the first oxygen is bound, it is converted into oxyhemoglobin. So the bonds holding the globin units will be released, producing a relaxed or R configuration, which will expose more and more of the oxygen binding site. So the net result is an increase in the 500-fold in the oxygen affinity. And this is one of the reasons for the sigmoid nature of the oxygen hemoglobin dissociation curve. So basically the interaction or the bond between the hemoglobin and oxygen, it is that it is basically a loose as well as a reversible combination, as well as there occurs oxygenation reaction, and there occurs heme-heme interaction or TR interconversion, that is type configuration is converted it into R configuration. So these are some of the properties of the hemoglobin that facilitate oxygen transport, that is loose as well as reversible combination of hemoglobin as well as oxygen. Then here the reaction is basically oxygenation and not oxidation. And another property that facilitate the oxygen transport is the heme-heme interaction, or the conversion of the TENS configuration into R configuration, which is known as the TR interconversion. And when the blood, it is equilibrated with 100% oxygen, that is whenever the partial pressure of oxygen is 760 millimeters of mercury, the normal hemoglobin becomes 100% saturated. So when fully saturated, each gram of the normal hemoglobin, it contains around 1.39 ml of oxygen. However, the blood normally contains a small amount of inactive hemoglobin derivatives, and the measured value in vivo, it is lower than that of 1.39 ml. That is, the actual value you will be getting is 1.34 ml of oxygen. So, in a person having an average hemoglobin concentration of 15 gram per deciliter, that is, you know that in women the average is around 14 gram per deciliter, and in males it is around 16 gram per deciliter. So, if we take an average hemoglobin of 15 gram per deciliter, therefore 1 deciliter of the blood, it contains 20.1 ml, that is 1.34 multiplied by 15, that is 20.1 ml of oxygen will be bound to the hemoglobin when the hemoglobin is 100% saturated, and this can be asked as an MCQ. Next is about the oxygen carrying capacity. The definition for the oxygen carrying capacity is that the maximum amount of oxygen that can combine with the hemoglobin in 100 ml of the blood when hemoglobin is 100% saturated, and the value you have found out to be 20.1 ml of oxygen per 100 ml of the blood. But you all know that in vivo, the hemoglobin in the blood at the end of the pulmonary capillaries, it is only about 97.5% or approximately 97% saturated, because of the slight admixture of the venous blood that bypasses the pulmonary capillaries, as in case of physiological shunt. So, the hemoglobin in the systemic blood is only 97% saturated and not 100% saturated. So, we have seen that if the blood is 100% saturated, then the oxygen carrying capacity is 20.1 ml. But as the systemic arterial blood is only 97% saturated, only 19.8 ml of oxygen will be carried as bound to hemoglobin per deciliter of the blood. So, the arterial blood where the hemoglobin is 97% saturated, the total oxygen content is about 19.8 ml of oxygen per deciliter, of which the 0.29 ml will be in the dissolved state or in solution, and the remaining 19.4 ml it will be bound to the hemoglobin. So, almost 19.5 ml is transported bound to the hemoglobin, and only 0.29 ml will be transported in the dissolved form when the hemoglobin is 97% saturated. In venous blood at rest, the hemoglobin is only 75% saturated. So, the total oxygen content, it is about 15.2 ml per deciliter. All these values you have to by heart, and all these values are taken from Gannon. And out of this total oxygen content of 15.2 ml per deciliter, 0.12 ml of oxygen will be transported in the solution form or in the dissolved state, and the rest 15.1 ml will be bound to the hemoglobin and is transported through the venous blood. So, at rest, the tissues, it actually remove about 4.6 ml of the oxygen from each deciliter of the blood passing through them. So now we will see the concise form of the oxygen transport. First of all, about the oxygen content of the blood. So it is the total amount of the oxygen in 100 ml of the blood. That is, it is the sum of the oxygen combined with the hemoglobin and in solution together. So the total of these two values will be the oxygen content of the blood. So you can see here that in arterial blood, the oxygen content, it is around 19.8 ml per deciliter, and out of this 0.29 ml will be transported in the dissolved form and 19.5 ml will be bound to the hemoglobin. Whereas you can see here in the venous blood, the total oxygen content, it is about 15.2 ml per deciliter, and out of this 0.12 ml will be in dissolved form and 15.1 ml will be bound to the hemoglobin. So that is about the oxygen transport occurring in our body, and the rest, that is the oxygen hemoglobin dissociation curve, will be dealt in the next video. Thank you.